May I invite the last group to join the stage with such an intriguing topic about Microglial NLRP3, inflammasome activation, mediates diabetes-induced depression-like behavior via triggering neuroinflammation. Presented by Mr. Zhang Yang Xu.
University. Today my topic is Microglial NLRP3.
Excuse me, can you open the presentation, please?
Hello, the delegate. Please open the presentation. Okay, thank you.
Thank you so much.
Okay, you can start now.
The PO Medical University. The main topic is microglial NLRP3 inflammation activation mediates diabetes-induced behavior, the neuroinflammation, and my advisor is Dr. Wen Jun. Recently, abundant evidence shows that diabetes increases the risk of depression. I'm listening. Okay.
Okay, can you please speak again?
Yeah, I can hear you. Guests and colleagues, I'm Zhang Yang Xu from the POA Naval Medical University. Today, my topic is Microglial NLRP3 inflammation activation mediates diabetes-induced depression and behavior via triggering neuroinflammation. Recently, abundant evidence shows that diabetes increases the risk of depression. This comorbidity largely increases mortality and disability and seriously threatens the diagnosis and prognosis of the disease. However, the underlying mechanism is still unclear. Therefore, we intend to research how diabetes induces depression. In our previous research, we found that NLRP3 inflammation plays an important role in the development of stress-induced depression. Meanwhile, NLRP3 inflammation is also involved in the pathophysiology of diabetes. It is reported that its activation can be detected in peripheral blood mononuclear cells of both diabetic and depressive patients. Based on these clues, we speculate that the activation of NLRP3 inflammation may mediate diabetes-related depression in some way. Generally speaking, the activation of the NLRP3 inflammation consists of two steps. The first step involves the priming signal. PMAPs or DMAPs are recognized by toll receptors, leading to the activation of NF-kappa B mediated signaling, which in turn promotes expression of inflammation components. The second step involves assembling the components of NLRP3, ACC, and procaspase-1 into a complex. Next, procaspase-1 automatically cleaves itself to become caspase-1, which further cleaves the precursors of interleukins into interleukin-1 beta and interleukin-18. In this study, we firstly divided the experimental mice into two groups. One group was used as a control, and the other group was used to establish a diabetes model by intraperitoneal injection of streptozolizum. 2 days later, mice that had received STZ injections were screened as diabetic and non-diabetic based on their blood glucose levels. Then the diabetic mice were randomly divided into two groups. One group will receive 7 days of MCC950 injection, which is an inhibitor of NLRP3, and the other group will be administered with solvent vehicle every day. So we got a total of 4 groups of mice here. On the 10th day post-STZ administration, we evaluated the behavioral and the metabolic performance of these mice. On one hand, MCC inhibitors did not relieve diabetic symptoms like weight loss and hyperglycemia in mice. On the other hand, diabetic mice exhibited a shorter urine sniffing duration in the female urine sniffing test and a longer immobility duration in the tail suspension test, indicating depression-like behavior. Interestingly, MCC administration showed an antidepressant effect. Subsequently, we found that expression of microglial biomarker IBA1 increased in the hippocampus of model mice, and MCC had a significant inhibitory effect on it. To further investigate how hypoglycemia activates microglial NLRP3 inflammasome, we established an in vitro high glucose model in the BV2 cell line. The osmotic control group was set up to exclude the possible effects of osmotic pressure. As to the signal 1, we found that high glucose environments in vitro enhance the phosphorylation of NF-kappa B P65 subunit. Nevertheless, after using TAK-242, a specific inhibitor of Toll receptor 4, we confirmed that the activation of NF-kappa B here is independent of the classical Toll receptor 4 mediates pathway. Regarding the activation signal 2, the result shows that the high glucose environments in vitro affected multiple key molecules involved in the activation of microglial NLRP3 inflammasome. Specifically, we intervened with these targets individually by using selective inhibitors to investigate whether they participate in the process. The results showed that inhibiting P2X7 receptor or double-stranded RNA-dependent protein kinase could block the production of interleukins-1 beta induced by high glucose environment. Furthermore, the RA scavenger S-listin hindered the phosphorylation of PKR and downregulated the expression of TXNIP and blocked the activation of inflammasome and the subsequent interleukins-1 beta and the production induced by high glucose. At last, we confirmed that MCC950 could inhibit high glucose-induced microglial inflammation activation. To summarize, this study shows us, firstly, diabetic mice show depressive-like behavior and activation of microglial NLRP3 inflammation in the hippocampus. Secondly, inhibiting NLRP3 inflammation was effective in alleviating depression-like behavior induced by hypoglycemia. Thirdly, high glucose environments enhance the phosphorylation NF-kappa B P65 subunit through a Toll receptor 4 independent way, thereby priming the NLRP3 inflammation. Finally, high glucose triggered microglial NLRP3 inflammation activation by enhancing RA's production, as well as upregulating the expression of P2X7 receptor and TXNIP, and promoting PKR phosphorylation. These results partly explain why patients with diabetes or hypoglycemia are more likely to have comorbid depression. More importantly, it proves that targeting microglial inflammation is a feasible strategy for the treatment of diabetes-related depression. That's all my presentation. Thank you for listening.
Thank you so much for this cohesive presentation.
Do you have any comments or any questions?
Thank you so much.